So I want to thank all of you members of the media for coming today. As I said, my name is Kim An Win, and I'm very fortunate to be representing the Blood Bank of Hawaii. I want to address the people of the state of Hawaii. It is times like these when we are dealing with a disaster, such as COVID-19, a threat to our very lives and our safety. It's times like these when we're all reminded of what's really important. And it's not just what we want to do, what we like doing, and it's not even what's important to us. But today I want to talk about, it's times like these when we are reminded of what is critical and essential. What's critical and essential. And today I want to talk about not just what is critical and essential to our society, our people, the people of Hawaii, what is essential and critical, but also who are essential and critical. And I think this is where I think maybe we want to think about things in a slightly different way. What and who. So, what is critical and essential? I think you've seen and heard many times over the last several days that Hawaii's blood supply is critical and essential. That's the what. Why is the blood supply critical and essential? Because every day patients die, people have cancer, mothers give birth to children, people get into car accidents. That we know, that every day little disasters happen. So that means every day 100 to 200 patients need life-giving doses of blood. That we know. Why is it critical and essential that Hawaii's blood supply be kept up and safeguarded at a time like COVID-19? It's because times like this, drastic times, call for drastic measures. And it's times like this when the leaders of our community, the governor, the mayors of our land, have to make difficult decisions. And as you heard, Governor Ige called for a lockdown of the state, a shelter in place. And the mayors of all of the counties called for shelter in place. And so the citizens of Hawaii and all of the counties have stayed at home. And so that puts into jeopardy the what? The blood supply of the state of Hawaii. And so I have gone out on TV and in the media over the last several days and appealed to the people of Hawaii to remember the what, that the blood supply of Hawaii is critical and essential and must be upheld and safeguarded at all times. But I want to today talk about an additional part of what is essential and critical, and that is the who. So as you've seen on TV in Italy, in Korea, in Japan, in other countries, in New York, Seattle, California, here in Hawaii, the who, some of the who that is critical and essential in fighting this disease are our healthcare workforce. The who is our healthcare workforce. The who is the healthcare workforce of this society, and it's the men and women who take care of the patients who are sick. They're the critical and essential workforce. And the Department of Homeland Security in this country have identified the critical infrastructure that must at all times be working in order to ensure that this nation continues to function. We know that, and we have seen that the healthcare workforce must continue to operate. But today I would like to tell you about an unseen, an unsung member of the healthcare workforce that you didn't know about. And it is the blood donors of Hawaii. Blood donors, that's right. This healthcare workforce is a casual, on-call, part-time, casual, on-call part of our healthcare workforce. And that is not something that I just made up. So if you go to the Governor Ige's proclamation that was put out on Sunday, and you reference his document reference a guidance put out by the Department of Homeland Security. And that document talks about the essential critical infrastructure workforce. And there's a section that identifies healthcare and public health. And in that document, it specifically calls out blood and plasma donors and the employees of the organization that operates these organizations. So it's very clear, blood donors are a part of the healthcare as critical and essential infrastructure workforce. I bet you didn't realize that. And that's because these are not full-time healthcare workers. All of you blood donors are not full-time. You're on call. You're unseen. You're unsung sometimes. But make note, you are critical and essential. How many of you are there? Well, if you add up all of the doctors and nurses and healthcare workers at Hawaii's hospital, how many would there be? 20,000, 22,000? Now add up how many unique blood donors come to the Blood Bank of Hawaii a year. We are talking about 25 to 30,000 unique blood donors a year. This is our unseen, unsung, casual, on-call, critical and essential infrastructure workforce. Essential, critical infrastructure workforce. And let me read to you what the Department of Homeland Security says. The Department of Homeland Security says to all of us in this workforce, if you work in a critical infrastructure industry as defined by this document, such as healthcare services, you have a special responsibility to maintain your normal work schedule. And that is because if we don't report to work, our society breaks down. And so I want to reiterate that in times like this, we distill it down to not just what is nice to have, not just what is important, but what is critical and essential. What? The blood supply, and who? The healthcare workforce. So, my message today to the people of Hawaii is, it is our job at the Blood Bank of Hawaii, just as it is the job of the leaders that run our hospitals in the state of Hawaii, to ensure that there are enough beds and that there is a capacity in our hospitals and clinics. So it is Todd Lewis, our COO's job to ensure that we create the bed capacity at the Blood Bank of Hawaii so that our blood donors can donate enough blood to meet the need of our patients. Just like it is important for the people who run our hospitals to ensure that the workforce, doctors, nurses, hospital workers, are safe and healthy when they report into work, it is our job, Dr. Mercy Kurian's job as medical director, to create an environment that when our blood donors, that workforce, reports to duty to donate blood, that it is safe for them to donate blood. So as you can see, our hospitals have a job And right now, they're focused on scrambling to create additional capacity, bed capacity. We are scrambling to create additional bed capacity for blood donors. Our hospitals are scrambling for personal protective equipment to create a safe environment. We have created and made sure that we have an environment for our blood donors to donate blood. And today I'd like to talk about what we've done to increase our bed capacity and what we've done to ensure a safe environment for blood donors. I want to talk about one other thing, that it is not just safe, but it is compliant with the governor and the mayor's ordinances to come out and report to duty. And I want to thank Mayor Caldwell and the other mayors for recording their messages. And we will be making those messages available after this conference. And we also want to answer all of your questions. So before we go to the question and answer, I want to end with this. I am confident that with the strong leadership of our state and county leaders, with our governor and our mayors, that the state of Hawaii will be able to control this COVID-19 infection and outbreak in this state. But we can't do it alone. We can only do it through solidarity. Solidarity, solidarity, working together. Our job is to make sure that what is critical and essential continues to run. And I want to let you know that the blood supply, the what, and blood donors, the who, are critical and essential. And together, we will ensure that the what and the who continues to function. And I want to ask each and every one of you, the casual and on-call members of the healthcare workforce, please go to bbh.org. We are putting together an on-call schedule for our on-call workforce. Please go to bbh.org or call 848-4770. This is not a sprint. This is a marathon. Your schedules are being created, and it's not for today or this week. We don't know how long COVID-19 is going to last. So we're putting together a schedule for our workforce that will go into next month, the month after that. What we ask of you is, when we call, please consider reporting for duty because we need you. Thank you. So now I'd like to take any questions that you might have.
Can you hear me?
Yes.
I posted a series of questions in the chat function. First of all, what is your name?
My name is Kim An Nguyen.
Could you spell both first and last, please?
Kim-ANH and last name Nguyen.
And your position?
I'm the president and CEO. May I ask who's calling, please?
Alan Pericchini. I'm over on Kauai. I'm writing for Civil Beat.
Okay. So can I ask if you could, how about this, if I answer the first question and then we're going to ask you to wait and then we'll take another question, one question at a time, and then we'll definitely want to get to your other questions. Will that be okay?
Sure.
Okay.
First question is there a blood shortage now in the state? And if so, how serious is it? And how may that change?
Excellent question. So as of this morning, and just to let you know that Blood Bank of Hawaii every morning has a situation huddle. And we check every morning for how much blood we have on our shelves and how much blood is on our hospital shelves. Before COVID-19, people may be surprised to know, before COVID-19, it is our goal in the state of Hawaii that the entire state has a 1 week, 7-day supply of red cells. Half of that supply is on our shelves. Half of that supply is on the shelves of all 18 civilian hospitals and at Tripler Army Medical Center. So, 1 week's blood supply. As I said, the blood supply of the state of Hawaii is fragile and perishable. The good news is, as of this morning, all hospital blood orders were filled. And as of this morning, we had an adequate blood supply of all red cells of all ABO types. That's of this morning. But every day is different. So we strive for a 3-day supply of red cells. Platelets, little different story. Platelets, we strive for a 1 to 2 day supply. And as of this morning, our supplies were holding. Good question. Do we have another question from anybody else? Okay.
Do you expect the situation to stabilize, worsen, or improve?
So that is a great question, and first of all, let me explain that as with everything else, the situation is changing day by day. So let me tell you a story about last Friday. So last Friday, every day we look at our appointment schedule. Every day we look a week in advance. And we expect to have 1,100 appointments. And we're happy when we see at least 1,000 appointments for the next week. As we opened the morning last Friday, we were looking at 233 appointments on a goal of 1,100. So that's an 80% deficit. So when we look forward at an 80% deficit, that we look forward to a critical shortage. When I went out to the media and made the appeal, within 2 days, the people of Hawaii raised their hands, and within 2 days, we are looking at covering half of that deficit. So by the middle of the weekend, we were looking at 600 appointments on a goal of 1,100. So that is how the people of Oahu came up and stood up and pledged to donate. We are not out of the woods. That is just 1 week. As I said, this is a marathon, not a sprint. We don't know how long COVID-19 will last. And so that is why I need to ask you to think about it this way, that we are putting together an on-call schedule, and we are going to ask you as the workforce to please check your on-call schedule. This is appointment only for your own safety. And please check the schedule, and please pledge to look at your shift and schedule for your shift to show up, maybe not this week or next week, but it might be next month, to donate. That is how we have to rethink blood donation during COVID-19. Excellent question. Next question.
I'm over on Kauai, and the neighbor island campaigns have been indefinitely suspended. How many units do you typically get from the various neighbor island collection sessions? And what are you going to do to make up that deficit, since we can't get to you?
So that's also an excellent question. And as I said, this is about solidarity. This is about figuratively joining hands, even though we're physically distanced. So we in Hawaii are all about doing our share. So just so that everyone is aware, we collect blood on all the major islands. And not only that, but all the major islands strive to be self-sufficient. Because of COVID-19, we've had to suspend blood drives on the neighbor islands. The last blood drive we did was on Hilo. And I want to thank the people of Hilo. They came out in droves that Friday. And I personally called and thanked Mayor Harry Kim for the people, for Hawaii Island. So 20% of Hawaii's blood supply comes from the neighbor islands. And so we have had to suspend the drives on Kauai Island. I talked to Mayor Derrick. And first, I want to reassure all of our neighbor island hospitals that we will continue to ship blood to all neighbor island hospitals. We ship blood daily. I want to thank Peter Ingram of Hawaiian Airlines for publicly maintaining his commitment to transportation of life-saving blood to all neighbor island hospitals. Second thing I want to do is to thank Mayor Caldwell for stepping up and asking the people of Oahu to step up and temporarily helping out the people of Kauai, Maui, and Hawaii Island, and reassure people of Oahu that Kauai, Hawaii Island, and Maui, that those citizens are waiting for the day that they can return Oahu's generosity with interest.
We have a question from Hawaii News Now.
All right. Can you kind of explain people who want to donate, what is the process they need to do? Do they just show up? Do they call? What is the process?
Excellent question. So this is a new world, and the new world is to ensure, number one, adequate capacity, bed capacity for our donors to do their job. The second is physical distancing. We cannot, for the safety of our donor workforce and our staff, we cannot allow large groups of well-intentioned blood donors to show up at the door. And so we have created 5 pop-up donation centers throughout the island of Oahu. We have reopened our Dillingham headquarters to be a pop-up donor center. We have created shifts by appointment only for blood donors. So please check bbh.org or call 848-4770. The shifts are what we call our appointments. They are spaced out to ensure that no more than 6 or 10 people, donors, at any donation center at any one time. 6 feet apart, that it's orderly and that it's clean, and it also ensures that our staff have extra time to pre-screen donors, extra time to clean all donor beds in between each donation. We need to ensure safety for our donor workforce. So please check bbh.org and please call 848-4770. Excellent question.
Our next question is from Hawaii Public Radio.
Please go ahead.
Yeah, so I guess you've already answered that as far as what precautions you are taking to address COVID-19 concerns. But I guess do you know if coronavirus can be transmitted via blood samples or anything like that?
That's an excellent question. So COVID-19, although it is novel, bloodborne viruses is not novel, and there's a lot that we know about that. So I'm going to turn it over to our medical director, Dr. Mercy Kurian. Dr. Kurian, I know that COVID-19 coronavirus is new, but before coronavirus there was pandemic influenza. So, and before that there was SARS. So what is known about transfusion transmitted pandemic influenza or influenza?
So, in the past, there have been several studies done based on SARS and the Middle Eastern virus and various influenza viruses. And what has been found is that from testing thousands of donors who, when they came to donate, were feeling fine and healthy, but later called in saying that they had some type of flu symptoms, that blood was taken and the samples tested, and it was found that none of them had the viral load enough to transmit the disease from their donation to a patient. So the answer is that no, this neither SARS nor any previous type of coronavirus, nor has this virus, is it from all the studies done, is there a possibility that it could be transmitted through blood? Of course, if you're very, very sick and you came to donate blood, and I'm sure we would stop you at the checkpoint, but if that did happen, then your blood might have enough of the virus to give to somebody. But that is a very unlikely scenario. So because of all the checkpoints that we have, the pre-screening we have, asking you questions before you come to donate, we eliminate people who could be carrying the virus from coming to the blood donation scene, and neither can they give blood nor could they get past the checkpoint.
Right, so again, we have been, at the Blood Bank of Hawaii, we have been doing this for a very long time. So let me just repeat. One of the things that Blood Bank of Hawaii has taken very seriously is safeguarding Hawaii's blood supply. If you remember, Hawaii has dengue and Hawaii has had the risk of Zika. And because Hawaii takes blood safety so seriously, Blood Bank of Hawaii has had a very close relationship with Department of Health. And Blood Bank of Hawaii was the second blood center in the United States to implement a test for Zika virus when it was experimental. So Blood Bank of Hawaii has partners in the United States that are at the leading edge of testing technology. There is currently no test available for COVID-19 or coronavirus in blood. The only tests that are available are tests, as you know, requiring nasal swabs. But rest assured, if a test becomes available in blood, and if the test will help prevent transfusion-transmitted coronavirus, Blood Bank of Hawaii will be one of the first to consider testing. But at this point, as Dr. Kurian says, there have been no cases of coronavirus, influenza, or other respiratory viruses being transmitted through blood. So that's number one. Number two, however, things are changing, and we're just not waiting for the worst to happen. We're being very, very, very precautionary. Number one, we ask that our critical infrastructure workforce, you blood donors, heed the governor and heed the mayor's orders. Stay at home. Keep up with your nutrition. Stay safe. Be healthy. We need you. You are our workforce. Keep your blood safe. Keep yourself healthy. When we call you, we need you to be healthy. Number one. Number two, if you are not healthy the day that we ask you to report to duty, call us, call in sick. Do not come into work. If you come into work, we will take your temperature. And if you have a fever, we will ask you to turn around and take care of yourself. Number three, if you're healthy when you donate, and then after you donate blood, you get a fever, call us. We will take that blood that you donated already, quarantine it, and not give it to a patient, even though there's no evidence that your blood can transmit COVID-19. So knowing everything we know, we're still doing everything we can to be safe.
As a reminder, please, everyone, if you're not asking a question, please mute yourself. Our next question is from KHON2.
Hi, Kim. This is Lauren Day from KHON2. Can you hear me okay?
Yes, loud and clear.
Okay, great. I have a question. Are the number of donations down, and by what percentage compared to usual months? Perhaps you can talk about the number of donations Blood Bank of Hawaii needs per day and how much you've been getting lately.
That's an excellent question, and I'm going to ask our COO, Todd Lewis, to give some specific numbers. But so before COVID-19, we relied on between 100 and 200 whole blood appointments a day. That was to meet our everyday patient needs. That's not including platelet appointments. So the question is, how much blood does Hawaii need in COVID-19? We know and we've heard that our major hospitals are stopping or holding off on elective surgeries. So someone will say, Kim Ann, Dr. Nguyen, don't you need a lot less blood now? Because hospitals aren't doing elective surgeries. So the answer is no, Hawaii still needs blood. Here's why. A lot of elective surgeries are minor procedures that don't use blood. But the need for chemotherapy, the need for emergency heart surgeries, the labor, the deliveries, the babies that go bad, the automobile accidents. Yes, there's a lot less traffic on the roads, but people still get into accidents. The falls, all of those still need blood. So on the mainland, we have been anticipating about 15% reduction in blood needs. That is still quite a few. So locally, what have we been seeing? Our platelet utilization, platelet needs are still strong, still strong. So let me turn it over to our COO to ask Todd, specifically Todd, with our new bold plan, our bold new plan, our new pop-up donation centers, what is our bed capacity to collect blood each day?
Thank you, Dr. Nguyen. As Dr. Nguyen has stated previously, our responsibility to the community in the state of Hawaii is to be prepared at all time, and that's an equation to the safety of the blood supply. And so with our bold new plan, we need to, and you guys have heard on news and media throughout the years, that we need 200 donors every day. And we had received over 4,500 donation cancellations through the month of April. So we redesigned our operations to have several locations open every day throughout the island of Oahu. We have a bed capacity and appointment capacity throughout the day combined at all locations of 215 appointments, 7 days a week. We need to see 200 donors every day so that we can maintain that safe blood supply. In regards to your question on blood utilization, Dr. Nguyen talked about our platelet needs have stayed strong. What she means by that is we're still sending the same amount of platelets every day before COVID-19 as well as today. We have not seen a dip in those needs. And so it's important that you call and schedule that appointment. We're all about safety, safety, safety. Safety of the staff, safety of the donors, and safety of the blood supply. And so our operations are set up to meet the CDC and Department of Health recommendations on physical social distancing and with the 6 feet space that you heard earlier. So please call 848-4770 or go to our website at bbh.org to make that appointment. The one thing I also want to stress, I've been asked a lot of questions about how long we think this is going to last. None of us know how long this is going to last. So therefore, Blood Bank of Hawaii on its own also canceled drives through the month of April. We anticipate this to go on at least through the month of April with this new bold plan of collecting blood at these locations on Oahu only. So please, you heard Dr. Nguyen talk about. This isn't a sprint that we need thousands of donors to donate today or tomorrow. We need you to call and make a pledge. Our tele-recruitment department will schedule you at the location that's convenient for you, as well as where we need you. And so those locations are Young Street, our normal Young Street Donor Center. We've also opened up our Dillingham headquarters location. These are open 7 days a week. We're on the east and the west side of Oahu. We're at Waikele Shopping Center as well as the Kroc Center on any given day. And then we're also on the east side in Kailua Town Center as well as Kaneohe Bay Shopping Center. I also want to thank those property managers. They reached out to us to offer their help and support. So after talking to them about our needs, Waikele and Alexander Baldwin and folks like that are the property managers, I really, really appreciate you stepping up to the challenge and supporting this life-saving mission.
Thank you, Todd.
Our next question is from Hawaii Public Radio.
Yes, so what blood types do you need the most?
So that is an excellent question. So here's the answer. We need your blood type. We need your blood type. Everybody would love to know that there is favored nation status or rarest. So of course, we all talk about universal blood. O negative being the universal red cell type. And so yes, that is Hawaii. We always talk about this. Hawaii is different. It is different, and from blood point of view, it is absolutely different. So Hawaii has half the percentage of O negative donors than the mainland. So the mainland has about 7% of the population is O negative. Hawaii has 3 to 3.5%. So those of you who are O negative, yes, you are rarer here in Hawaii. But Hawaii is, but O negative is just one of the precious types. O positive blood. O positive blood is the next universal red cell type. Extremely important for trauma, deliveries, open heart surgeries, and emergencies. That's for red cells. If you flip it for burns, for dialysis, for liver transplants, now we are talking about the liquid part of blood, plasma. What is the universal blood type for plasma? It's not O negative, it's AB. AB. So if you're AB type, you are the universal. So what am I getting at? I am getting at every type is precious and every type is needed. For platelets, it's every type. And there are certain types that in Hawaii, because of our Polynesian and Pacific Island ethnicities, we have the nation's largest repository of this extremely rare blood type that cannot be found throughout the rest of the mainland. And we must keep this repository up for ourselves, for our people, and for our children and family who live on the mainland. We must keep this up. Because if Blood Bank of Hawaii doesn't collect this blood, it cannot be found. That's JK3 negative and other blood types. And so my answer is, we need your blood type.
We have a clarification from an earlier question for KHON2.
Yes, you guys said that you need 200 donors every day to maintain blood supply. How much have you guys been receiving lately, let's say Monday or Tuesday of this week?
I'll take that question, Dr. Nguyen. That's a great question. And so Dr. Nguyen talked about that 7-8 day outlook we look for on appointments and our goal of 1,100 on that week-long total. As of Friday, we had 233. And so we have to, as I talked about earlier, our job is also to maintain that safe blood supply. And so we've been averaging over the last 4 to 5 days about 130 donations. And so this is one of the reasons we need to continue to get the outreach to the community, the need, that we need to make those 200 appointments, and so that we can get the procedures we need. We have different types of procedures that we also do. And that's back to what Dr. Nguyen talked about. We have procedures for platelets, we have procedures for plasma, we have procedures for red cells. And so please make that appointment. Call that 848-4770 or go to bbh.org so you can help us, and by making that pledge so we can get to 200 appointments every day. And so to answer your question, we're short, we're low on appointments right now. We're averaging about 133, 135 over the last 4 or 5 days.
So let
So
me
you're
just,
down about 35%.
Yep, that's
Yeah.
Yep.
let me
Okay.
just clarify. So if you, for instance, I want us all to think about our operations very similar to what New York and California is experiencing with their hospitals. So New York, as you know, is looking at building or not building, but creating a hospital, a makeshift pop-up hospital at the Jacob Javits Convention Center. Blood Bank of Hawaii in 1 week has created pop-up makeshift donor centers or donation centers in Kaneohe, Waikele, Kroc Center, Dillingham headquarters. These are pop-up donor centers, and this week was our first launch. And so this is a proof of concept. So this is our first week. Our goal was not to make up the capacity that we had before COVID-19. Our goal was to prevent patients from dying. That was our goal. And so our goal was not to make 100% of our capacity. Where are we now? Probably at maybe 70% capacity. We're not going for 100%. We cannot. We don't have the bandwidth to do that. So, but that's what we can do. So let's make sure that we can collect and keep donors safe. That's number one. In the next weeks to months, the next 2 or 3 weeks, our team's goal is to ensure, number one, that the capacity we created is enough to meet needs. The next thing is to make sure that it's going to run smoothly. So please be patient with us, because if you're seeing glitches with our website, if you're seeing glitches, that's to be expected. It's very similar to what you may be seeing as Hawaii Pacific Health, the state hospital system, Kaiser, Queens. We're all scrambling here. So just be patient with us. So our goal right now is at least 70% of our old capacity.
Let me ask now if there's any other questions.
Yes.
Go ahead.
Could you address the issue of whether you anticipate having to fall back on mainland resources to make up the shortfall here? And if so, are there adequate mainland resources to help you do that? And also, what have neighbor island hospitals, and I'm thinking in particular of Wilcox here on Kauai, what have they been told to expect?
Oh, excellent question. So, the beginning of March, when this all happened, I went to Washington, D.C. to meet with all of the leaders of the blood centers in the United States. And we were very concerned because we watched what was happening in Seattle, and we watched what was going on in other countries, and we started to plan for the worst and hunker down. So, and they all looked at me because they all knew that Hawaii had greater challenges than other blood centers on the mainland. And so we have been trying to get imports from the mainland just as a proof of concept. And as we predicted, unsuccessful. in getting imports. If not because other blood centers have been seeing 30 to 40% decreases in their own collections, also because we're concerned about cargo shipments of blood. And so, as everything, Hawaii has to provide for its own in times like this. But I'm not concerned, and here's why. We have our own blood supply, and Hawaii's blood supply is walking around in the people of Hawaii. If you count the number of people who are healthy and can donate blood, we have enough to meet our needs. If only the people who are in this critical essential workforce reports to duty when called. So I want all of us to remember that Hawaii can support its needs. Blood Bank's job is to have the bed capacity and to make sure that it's safe, and to make up the schedule over this long distance of time and call. The second thing is, what have we told the hospitals? And we are in constant communication with our hospitals. Dr. Kurian met with the leaders of the hospital blood banks to let them know ahead of time. And so we are transparent with our hospitals. Every morning we let them know what our inventory is. And so they already were told, have your contingency plans in place. Excellent question.
Okay. Are there other questions on the line?
Do you anticipate neighbor island hospitals having to wait longer for shipments once they request units?
We do not. That is our commitment to all hospitals. And again, I want to thank Hawaiian Airlines for publicly honoring their commitments. We are working very closely with them to ensure that now, obviously, as things change, we may have to all adjust how we order and when we order. So we all will have to adjust, but our commitment stays the same. We want to ensure no patients die or have a serious impact because there's not enough blood.
Thank you. Are there additional questions?
Would you use the word crisis? Would you use the word crisis to describe the situation?
I think COVID-19 is a situation that the world has never seen before. But I will leave it at this. I'm proud to be in Hawaii. I'm proud to be a citizen of this state, because what I've seen is strong leadership. I am cautiously optimistic that the bold, extreme, difficult decisions that have been made at all levels of government and business leadership, and it hurts, but if any of all the states in this country, I believe that Hawaii has the greatest chance for us to bend the curve. Hawaii has the greatest chance to bend the curve. We will see it if we all comply and work together. And Hawaii, Blood Bank of Hawaii is just one part of this. And so if we all work together and report for duty when we are called, we will kick this.
Is this a blood emergency?
I think this is a state crisis right now, but it is not a crisis the way that we normally. This is a crisis of the heart, and this is a crisis of courage. And during this crisis, I have seen people rise, and I have seen people crumble. And we are getting through this when we stay together and when we act with solidarity and when we think creatively. Hawaii, time and time again, proves that the way that we act with aloha and the way that we think creatively, I am more convinced than ever that we can show the rest of the United States that we can make it work and we can bend the curve. But we have to work together. So I don't think that it's a crisis the way we normally think. This is a crisis of courage, though, and we've got to get over our fear. Get over our fear and act. Solidarity. Solidarity. Step it up.